For 20 years, Health Ministries Network has supported faith community nurses, parish nurses, health ministers, and now community health advocates to bring about a healthier lifestyle in our community. Health Ministries Network is a nonprofit. We have a network of around 140. We have 3 categories. And the first are registered nurses. And they can be either called parish nurses or faith community nurses. The second category are congregational health ministers, who might be retired nurses, lay people who have some healthcare background. And then the third category is community health advocate, people within our community, not necessarily connected with the congregation.
We can be a person who answers questions about health.
The nurses have information. They don't do hands-on nursing. They don't bandage wounds or do that kind of thing typically.
What we bring to those nurses and health advocates is a wealth of resources.
I took the class through the Health Ministries program. They were great support to me when I first started doing this job.
We offer physical resources, we have a library, we have a toolkit for health transitions. We're a support organization. We believe that health is not just physical health. It has to do with mind and body and spirit.
Being present with people in times of crisis.
Supporting people when they have illness.
People that know that they're cared about are healthier.
We were taking blood pressures, and an individual had dangerously high blood pressure. And we recommended that this person got medical care immediately and was put on hypertensive medication that has now controlled their blood pressure. They would not have been aware had they not stopped at our table.
In October, I broke my wrist. The word spread rather quickly that I had done this. I had calls from the parish nurses. What do you need? What can we do? Do you need meals? What kind of support can we give you?
It's really life-saving. I can't emphasize that enough.
I'm kind of an active person and like to do active things. And I've always been physically active, so I started the exercise group just to get the women in our congregation to keep moving and to keep them being able to walk as long as they can. It's been really rewarding for me just to help keep people active.
The difference for churches that have a faith community nurse is that pastors are always coming in contact with folks who are dealing with something that's healing, health related. Pastors aren't nurses, aren't doctors. So a faith community nurse who is in touch with the pastor and vice versa is an ideal kind of ministry.
I think it's just a very valuable part of our church and our community.
It's really a wonderful program. We're glad to have it here.